Everybody right to go? There are 100 active cases of coronavirus in Victoria, with just one new case since yesterday's update. Today's case is a parent from the East Preston Islamic School. Currently no contact has been established between this new case and the current Northern Metropolitan outbreak. However, investigations are underway with the school and family to fully explore any possible links. Asymptomatic testing will now be offered to all members of the East Preston Islamic School community to ensure any possible links and cases are identified. Jerome will speak to that in just a few moments. Some individuals in the school community may also be identified as close contacts. These specific individuals will be called directly by the department, and there'll be absolute clarity about what they need to do and for what period. There are 8 Victorians in hospital, and none of those 8 are receiving intensive care. A total of 3,022,364 test results have been received since the beginning of the year. That's 19,428 since yesterday. That's a very, very strong testing number, and we thank each and every one of those close to 20,000 people for coming forward and getting tested. There's nothing more important. If you've got symptoms, you've got to get tested, and you've got to get tested fast. That's how we pull this thing up. That's how we stop you inadvertently giving it to others, who then in turn infect other people, and we finish up with, just from one single case, many, many people finishing up with this virus. So thank you. Thank you sincerely to all of those people who have come forward and got tested. That remains so, so important, and will be important for many months to come. There are 7 healthcare workers who are active cases. The rolling average to 22 October is Metro 5.5, Regional Victoria just 0.3. Mystery cases to the 20th of October are 10 in Metro Melbourne and none in Regional Victoria. I've already spoken about the one case today being from Darebin. There are now just 2 active cases in Regional Victoria. That's down by 1, and those 2, of course, are the balance of the 3 who were in Shepparton. So there are just 2 cases, and they're both from the Greater Shepparton area. There are now just 5 active cases linked to aged care settings, and they are all the numbers that I needed to go through today, other than just to say we are very well placed to make some significant announcements on Sunday, and they will be a testament to the absolute determination of the Victorian community to see this thing off, to do it properly, and to make sure that we got the numbers to such a low level that we have every reason to expect that we can keep them low, fixing the health problem and then moving on to deal with the important economic and very personal challenges that this pandemic has made clear. This is a good number. This is a very clear sign that the strategy is working, and that we are well placed to be able to have more to say about a program to steadily open up those safe and steady steps towards that COVID normal summer, a COVID normal Christmas, and a 2021 that is vastly different to 2020. I might now just ask Jerome to speak to some of that testing activity and the Northern outbreak activity, and then we're happy to take any questions you have. And I think you're all aware that I've got to get off to National Cabinet, so we'll try and keep things as focused as we can.
Thank you, Premier, and good morning. Yesterday's 19,428 tests, I think, was a very strong number, and we're so grateful to all those Victorians who came out to get tested today, yesterday across our entire state, and please, we need to see more of that over the coming days. I'm pleased that, just with a reference back to Shepparton, that we are now well through our day 11 testing, our follow-up testing from the outbreak 10 days ago, a couple of weeks ago, and we've seen no positive cases as yet in Shepparton. So the 2 old cases that are now close to finishing, and the day 11 testing is so far looking very positive. And my thanks to everybody in Shepparton for their outstanding efforts in not only getting tested, but also in clearly a strong sign of excellent behaviours in the Shepparton area, where we have 3 positive cases in their midst, but no onward community transmission. That's a really solid and confidence-inspiring move, and we're very grateful to the excellent behaviour we've seen there. Over the last few days, we've seen about 6,500 tests undertaken across our northern suburbs. I'd like to thank everybody who's come out in the last 2 or 3 days, particularly in the northern suburbs, to come out and get tested. We need to see more people coming forward today and over the next few days to make sure we really have run these cases to ground. Included in those 6,500 tests were 86 tests that we conducted yesterday and the day before at a community housing block in Broadmeadows. I'm pleased to confirm that all those tests were negative. We have found no other positive cases at the Broadmeadows community housing block. As such, the advisory notice that we issued the day before yesterday has now been lifted, and all those residents are able to travel as freely as the rest of us, in line with the current restrictions. I would, of course, urge all residents, not only of the housing block in Broadmeadows, but generally speaking across northern Melbourne especially, please monitor yourself very closely for symptoms. Please, if you have any concerns at all, come forward to get tested. We will maintain our testing station at the Broadmeadows community housing location for the next few days, and the ongoing local support teams will be there to deal with any local inquiries. But I'm very pleased to thank those people for the sterling work they did over the last couple of days. They came out to get tested. All those results are negative, and they can now return to some form of normality. In terms of the wider out case the Premier has mentioned, we have detected a new positive case, a parent who has a child at the East Preston Islamic College. I'd like to thank again the entire school community of East Preston Islamic College for their fantastic work in being so supportive in working with us to test as many people as possible. There are currently 83 families associated with the college who are in isolation, and we thank them for their efforts to ensure that we get through this period as quickly as possible. And there are, of course, follow-up conversations happening with them around the testing of themselves and their wider families. We are working closely and continue to work closely with that school community, and I would urge any family who has a child at East Preston College to please come forward for testing today. Regardless of whether you have symptoms or not, we are keen to ensure that we really run this to ground as quickly as possible. And the fact we now have 2 positive cases in the broader school community, and although they are not linked at this point, we are keen to ensure there are no other traces anywhere else in that wider community. So we would ask, it's a big area. We know there are families from all across the northern half of Melbourne who attend that school. There are many testing stations across the northern suburbs. We would ask you please today, come and get tested asymptomatically, and we will follow you through very quickly. As a result of the ongoing contact tracing, and of course we have the new positive case that will in turn generate more close contacts and more secondary contacts. At this point in time, we continue to have around 400 people who are secondary contacts of the cases at the East Preston College. We also have an additional 390 secondary contacts of the ongoing work spread across quite a large number of suburbs in the northern area. That makes around 800 people who we are currently asking to self-isolate as we continue to work through this outbreak. What we saw yesterday at Broadmeadows and what we've seen at Shepparton and what we've seen at Kilmore is the importance of going wide quickly, of testing as many people as possible, and then trying to focus in on any remaining cases that we have. That will be our approach, continue to be our approach over the next few days. And we're very grateful to the 800 people that we're asking a lot of to isolate, but it is really what we need you to do at this time to make sure that that we can run this virus to ground and make sure there are no other remaining areas of community transmission. And finally, we've had detected in our sewage surveillance program, which we've discussed a number of times, there are now 42 sewage surveillance sites all across Victoria. The sewage surveillance site at Ararat detected some traces of coronavirus on Tuesday. As a result, we have set up an additional pop-up testing site at Ararat today. It's at the East Grampians Health Service on Girdleston Street in Ararat. That'll be open from 9:30 today. It's open now. It'll be open all through the holiday weekend. We would urge anybody in the Ararat area who has any symptoms, no matter how slight, please come forward to get tested at that pop-up station. We clearly have some activity happening in the Ararat area. We're very keen to identify whether this is an old case or whether this is a new case that's developing. So, as we've seen a number of times at Apollo Bay and Anglesey, we've seen a great community response from these kind of traces or these indicators, these these early warning signs that there might be something afoot, we'd like to make sure that we run this one to ground as quickly as we did in those other two localities.
Were there actual cases found in those other localities?
No, we tested around 15% of the population in both Anglesey and in Apollo Bay. We, in the end, did not find a definitive case of coronavirus. But this is what the surveillance testing identifies for us is it's a warning sign that says that either somebody has travelled through the area who has been shedding the virus. It may be an old case in the community. It may be somebody who has come back from another part of the state, but it may be a new case. And at this point, it's a reminder to us that we are not free of this virus. We continue to have this exposure to all of our communities, and it's important that we listen to these early warning signs. So again, for citizens and for fellow Victorians in Ararat, please come forward today, and we will ensure to get you tested and to run this one to ground.
Just on the Northern Metropolitan outbreak, I've been told that local employers in those suburbs, in the Northern Metropolitan area, are requiring their employees to show proof of a negative test to come back to work. Is that a government requirement, or is that something that small businesses are doing on their own? I guess, what advice do you have on that matter?
Yeah, look, there is not, and there should never be a requirement for people to show negative test results in order to turn up at work. We have a very clear program of asking people who we believe to be primary contacts or secondary contacts to isolate and to be kept away for 14 days. They are not able to work, and that is why we have the $450 payment. That is why we provide the wider relief support to people who are either positives or who are close contacts to ensure they've got the means to do so. Anybody who is not a primary or secondary contact does not need to isolate, does not need to quarantine, and therefore they should be free to work, and there is no requirement for them to show evidence of testing.
Can the Premier just add to that, maybe, just in terms of employers, Premier, a message from the government?
Simon, I haven't heard those reports, but ultimately the only thing that matters is that no one who has symptoms should be going to work, and anyone who's asked to isolate at home, to spend time away from others in their home, they should comply with the request that's made of them, so they shouldn't be going to work. The other point as well, if you've gone to get a test because you were either asked to get a test or you had symptoms and you volunteered to get a test, then you have to wait until you get your results, and something like 96-97% of test results are now coming back the day that you have the test taken, or certainly within 24 hours. That's nearly all of them. Many are coming back only within just a few hours. So the message is that individual workplaces have got COVID-safe plans. Those plans are a partnership between the boss, the workers and customers. Everyone has to play their part, and the best thing that people can do is to make sure that if you've got symptoms, you don't go to work. If you're asked to stay at home for a period of time, then you have to do that. You can't go to work. Beyond that, though, there's no requirement to be walking around with a negative test in your pocket, because that's only a point in time anyway. That's only a point in time. That'll tell you that at that moment in time you didn't have it. It's not a passport. It's not effectively a vaccine against this that's got any utility beyond a very short period of time thereafter.
The parent who's tested positive, it might be one for Jerome.
Sorry.
The parent who's tested
Yes.
positive at the school. Did that parent attend school? Does their child have any contact with the positive
No,
case?
it doesn't look
and
like.
how long has the investigation been active into that parent's movements? Is that fresh last night, or is that pretty advanced?
Well, both in some respects. It'll be well advanced because we don't waste any time on this. But we would be investigating quite rigorously that person's contacts once they've got a positive test. But the advice I have is that they were not. Their child did not come into contact with the other positive case, and that person had not been to the school. There's no link. That's why it's a little bit uncertain, and we have to, as Jerome said, try and run that to ground. There's obviously some virus in that local community, and there can be a common feature, but it may not be causal. It may not be a link as such. As soon as we can update on that, of course.
Is that a sign that there's more at the school? Does that concern you and indicate that it is spreading in the school and
It doesn't.
an unknown place?
Yeah, it certainly doesn't confirm that, but that's why we've gone to test everybody at the school whether they've got symptoms or not. So that's why the messaging and the We'll be working with the school, have been since, well, for a couple of days now, but we'll certainly be working with the school today to encourage everybody in that school community to come forward and get tested.
Okay, so we expect that number of...
among those who'd been asked to isolate.
Sorry?
So that parent wasn't among those in the school community who'd been asked
I'm
to
not
isolate.
certain what category that parent was in.
Why not?
Well, because they had not had any contact with the person who's tested positive.
And the 800 people who've been told to isolate, have they been, is it a request to isolate or is it an order to isolate?
I'll let Joanne speak to that.
So just to pick up the new positive case, it's a parent who lives in Preston. One of their children attends the East Preston College. There is at this point, no obvious association between that positive case and the positive student that we discussed yesterday. Obviously, that contact tracing is going on. We had a very positive discussion with the new positive case last night, and we'll continue those conversations to try and assess where the case came from. Lundy, in terms of your question,
Yeah, the 800 people, is it a request to
Yeah.
isolate or is it an order to isolate?
No, so if we go back to how we now approach these kind of outbreaks, so we've identified primary contacts. Primary contacts are required to isolate and they will be tested. We'll be contacting them directly. We have contacted them directly, and we'll be testing them, and that work is ongoing. Their secondary contacts are also required to isolate. Generally, that tends to be their household, people living in their household, as is the case of the 83 or so close contacts we have at East Preston College. Their families, around 400 people in total, are being required to isolate. We have 390 additional secondary contacts from other close contacts that we're working through in this wider outbreak.
Jerome, how confident are you that those 800 people will isolate over this long weekend?
So we've had really exceptional feedback from both the initial conversations we've had with these secondary contacts. We've also spoken to a number of leaders across a number of different communities across Melbourne in the last couple of days. Again, their support has been fantastic. We saw that on the streets yesterday. So we're very confident that people understand how important it is that when you're asked and when you're required to isolate, that you do just that. There is a huge program of food relief and wider support we're making available to these families in terms of medicines and anything else that people need to discharge. We'll continue to work with them to do that, and we're very confident that they'll do the right thing and help us get to the bottom of this.
Will
Just
those
regarding
people,
the
sorry, just on the
student that
same
went
topic,
to,
will those...
Yep.
Just regarding the student that went to school with the virus, is there a clear sort of channel of communication between the Department of Education and the Department of Health? So the Department of Education knows that students are quarantining and should not be at school?
Yep. So we have strengthened those arrangements over the last 48 hours. So we now have an arrangement whereby where there are, given the very small number of close contacts we now have in Victoria, the very small number of active cases, 100 active cases, for those cases where they are students, there will now be communication, there is now communication between the Education Department and the schools concerned to identify any students who are positive and any students who are close contacts. And that
was that in place previously?
Well, because we're dealing in a situation now where we've got the number of cases we're dealing with are relatively low. We still have, as we have here, hundreds of close contacts of those 100 active cases. It is still a large field of people across the wider state. We're now at a point where we can manage those individual cases far more closely, and that's exactly what we're doing.
Are the schools aware that there are students attending the school that are quarantining?
They will be now.
But why weren't they previously given? I mean, we're sort of well into this.
Well, bear in mind that for the majority of the outbreak, we've actually had students working from home or studying from home, so the dynamic of our school life has changed significantly. We're now down to managing these remaining active cases and these remaining close contacts, and we have to be on our guard for that. The schools have been exceptionally collaborative on this basis, and the school networks are very strong in this regard. This is another safeguard whereby, in addition to the contact that the DHHS has with individual parents and individual close contacts and individual positive cases, the case management we already do, we're now extending that into the school leadership, and that's a positive way forward.
But Jerome, why has it taken a case at a school for the department to strengthen its ties with DET or improve those sorts of things or strengthen the arrangements? Why has it taken so long for the department to do that?
Well, because we've seen on the whole over the whole of this experience of the last 3 or 4 months, this whole second wave, we've seen the vast majority of people who are being required to isolate or required to quarantine have done just that. And we've seen that in all the outbreaks we've discussed over the last few months. The level of adherence has been excellent. We've seen now a clearly a misunderstanding that's led to a close contact child, not positive at that point, but a close contact child attending a school. That's allowed us to take another step forward to say we now need to tie it together with those school leaderships. You can't do that when you've got thousands of close contacts across the state.
Is there an individual case, sorry Jerome, is there an individual case worker from the department working with the school on this, and say from DHS with the school on this?
Yeah,
like,
so
is it down to that level?
It's at the level where we've got dedicated contacts with our colleagues in the education department working with those schools. And bear in mind, at the moment, we are dealing with a very small number of schools. We have a very low number of active cases in Victoria. We have a very relatively small number of close contacts. So we are working now individually with those schools that are relevant, and those discussions are ongoing. And again, the DHS case management teams are working not only with those 100 active cases, but also with those, in this case, 800 or so primary and secondary close contacts.
Those 800 people, will they be subject to spot checks by police this weekend?
The normal arrangements will take place, which is we will ensure that we will be checking up on those people on a daily basis to ensure that A, they understand their status, secondly, that they're checking in on their health and their well-being. That is our primary responsibility, and also ensuring that that they're staying where they are. There are ongoing check arrangements that we do through our authorised officers, police if necessary, and that work is ongoing.
And just with the Broadmeadows community housing, you said 86 people had been tested, but there was about 120, if I believe correctly,
That's right.
were isolating. Have the other 40 been tested, or what's
That's right. So we went round all the flats yesterday in the building. We tested the 86 people that were available to us during the course of the day. We believe there are another 30 or so people that normally reside at the building, and we'll be testing them over the coming days.
So I assume obviously the self-isolation is only lifted for those who have had their results.
No, the self-isolation has been lifted for all the residents of that particular block. What we were trying to do, again, the abundance of caution approach that we now take, is to say let's establish whether we think there has been any transmission in this building. We conducted a lot of discussions yesterday with the residents of the building to understand the social patterns that take place, who's seeing who is working with who. We ensure the deep cleaning of the common areas, and the testing results, given we've tested over 2/3 of the people in that building, we're confident that there is no reason to suspect community transmission beyond the original family that were there, and they were relocated a couple of days ago to alternative accommodation.
Where would the other, just following from Andrew's question, where were the other 30 people that you're still trying to test?
Well, so we were there for I think a 12-hour period yesterday. People have different reasons for either being in or not being in their property. We don't have, I don't keep a complete roll call of everybody on the building.
But you're still trying to get orders to, were you yesterday still trying to get the orders to them to isolate?
No, so the orders were, or the advisory notice was posted to them on the end of Tuesday night, so 36 hours ago. That was both through door knocking, direct conversations, phone calls, and notices and letters under the door. So we're confident that work was well done. We have a register of who is registered in that particular building. We've worked our way through that register. We've worked our way through the doors. We're trying to establish whether there's been any transmission in that building. Based on all the work we've done over the last 36 hours, we don't think there's a reason to believe that any more than any other set of buildings, and therefore we're taking the view that the people in that block have done what we've asked them to do. They've gone and got tested. We've got all the negative results back, overnight, and we're pleased to move on and focus on those remaining areas of risk.
Sorry, Jerome, just back on the DET.
Given they weren't in isolation, in the day or two before they tested positive, how many close contacts did they have? In which settings were they in? Were they an essential worker? What were their movements in the days in which they were infectious?
For which people we
The new
talking?
positive case last night.
So the new positive case, based on our initial conversations with her, has had very few contacts outside of the house, and we're continuing those conversations.
Sorry, Jerome, just back on the DET. Do you accept that those, channels of communication should have been in place before school started back up again?
No, I disagree. I think if you look at the history of how we've dealt with these outbreaks, how we support people with coronavirus, if you go right back to the provisions we make to ensure people have got access to funding if they haven't got work insurance of some kind, the food relief we provide, the support we provide, we're continuing to step up our response as we get to a smaller number of cases. And I think that the work we've done with the education sector has been of a very high standard. The education sector has responded exceptionally well in terms of the studying from home arrangements over the last, 3-4 months. And we continue to work with them to say, as we now see a small number of cases circulating in our community, we're now starting to, really track in on those and ensure that all the key stakeholders have got that information and can support those individuals to do the right thing.
Can I just ask sorry.
Go ahead.
No, you go. I was going to.
Okay, Jerome, just on regional contact tracing teams, if you don't mind. Are they still stood up, those localised regional teams, or is DHS taken back central control, looking at contact tracing in the regional areas?
No, the regional contact tracing teams, as we saw in Shepparton only the other week, have been an integral part of our response. It's allowed us to move faster, to connect better with local communities. It's been a really strong part of our response, and we will continue to drive that. We don't shy away from the fact that ultimately it is under the Chief Health Officer's powers that we direct all of this work program. Clearly DHHS, the team that I work with, have an oversight responsibility. We ultimately provide the legal authorisation for all the work around contact tracing. But the delivery through those regional teams has been exceptional, and the good news is at the moment we have no regional contact tracing to do. That's a good place to be. I suspect we will continue to call on them in the future, should we find another case, Ararat being a good example.
Premier, just a question for you, if I may, please. I know we've obviously discussed this in the past, that international arrivals won't be coming back to Melbourne until hotel quarantine inquiry report comes down.
Yep.
Do you expect that we may see international arrivals by Christmas?
That's certainly our aim. Yes, that's certainly our aim. We need to see the report. We then need to put in place arrangements that everybody can have confidence in, and I think National Cabinet later this morning will be talking about some of those issues. There's going to be, we know there are a significant number of Aussies who are overseas and want to be home by Christmas, and I'd very much like to have them flying direct into Melbourne, those that need to come to our state, flying direct.
And just to confirm, should the reporting date be pushed back, the international arrivals still obviously won't occur until that report comes in?
That is correct.
And Premier,
And I have no sense that that's going to happen. I have no sense that they're going to take longer. They may. I just don't think it's appropriate that we have flights landing before we've had a report into that very program.
Premier, are you aware if any Victorians are on these flights coming out of London and Dubai? And are you aware, is the government helping get Victorians back from Darwin once they've finished their quarantine?
I'm not aware of any I'm not aware of that, but I can try and chase it up for you. Obviously, there's quarantine arrangements that have been in place for quite some time now, where people go and do their quarantine elsewhere and then travel to Victoria.
And looking to Sunday, is there a potential to shift the boundaries a little bit in terms of what's classified as regional, like what you've done in Little River with, say, the Mornington Peninsula and, say, Cardinia Shire? Those.
Yeah, I think it's very important to acknowledge that the Little River Township is until last night's change, essentially cut in two by that boundary. The community is on both sides of that metro regional boundary. That is not the same as the Mornington Peninsula. That is not the same as a number of other communities in Cardinia Shire. On Sunday, I'll have more to say about those arrangements. 25 Ks, regional metro border, all of those issues are being looked at very, very closely, and we'll have those different restrictions in place only for so long as they serve a public health benefit and help us to keep the numbers low so that we can keep opening up. All of those matters will be things that I'll talk about on Sunday.
And with the new case at the school, that's no known connection to the other case notified yesterday, are you concerned about further easing restrictions on Sunday, given the fact that this virus could be in so many invisible places still?
Well, what we know is that there will be more virus out there than what we can ever detect on any given day, and that's the product of a few different things. One, not everybody gets tested, even though they've got symptoms. Not everybody gets tested as fast as they should, so they will move around the community or even in their own household for 2-3 days, sometimes longer even, and that can be the most infectious period. So short of testing everybody every day, there's always going to be some of this virus bubbling out there. That's why we're not trying to get it down to zero forever, because we would be closed for a much longer period of time if we tried to achieve that. What we do know is that there will be outbreaks, there will be cases. The really difficult judgments that will have to be made based on a rigorous analysis of today's data and all this week's data, plus data that we'll receive tomorrow, so case numbers and all these interviews and all the other work that we do, the results of the asymptomatic testing that's going on at the school today and probably into the evening tonight, all of those things will be weighed up, and then we'll make a judgment Saturday night about what's possible to be announced on Sunday. And I just again make the point, it won't be that a whole range of restrictions come off from Sunday arvo. It's going to be a lead-in. There'll be a couple of days, I think, for people to get ready for that. So we do have a few more days of data to come through before those changes would actually happen, but we're confident in where things are at the moment. But it is highly variable, it does move fast, it does move silently, and I can't with any certainty predict what the numbers will be tomorrow. But the strategy is working, the trend is with us, the numbers are falling, and that is a very good thing.
Is there any chance of a different set of rules on Sunday for the area where the outbreak is happening, if that does get worse between now and Sunday, for example on retail and hospitality?
I don't believe so.
Is it being considered?
No, I don't think it will be considered, because, well, I'll take you back to Shepparton, for instance. We had a different set of arrangements in Shepparton, and I think a regional community you can do those different settings in a regional city, regional township, much more easily than you can in the inner northern suburbs of Melbourne or even the outer northern suburbs of Melbourne. What we saw some months ago now was that there is such significant movement in and out. Unless you do like a literally hard lockdown where no one can go in or out, which then means nurses don't go to work, teachers don't go to work, police don't go to work, no products go in or out, no one in any workplace from those postcodes would be able to go to work. We just don't think that works. So let's do the testing, let's get the results, and then we'll be in a better position to know how much of it's in there.
Are you looking at...
Sorry, you go, Andrew.
Thanks, Elias. Are you looking at lifting hospitality limits further than previously suggested?
Everything's on the table, and we'll have more to say about that on Sunday.
Including lifting the 25k limit?
We will have more to say about all those arrangements. It's not just an announcement for one day. We hope to be able to give people a clear sense of what the next few weeks look like. That's what people want, and that's what we believe we're in a position to do. But again, in advance of Sunday, whatever we announce always has to be subject to whatever happens in the days and weeks prior to that. These case numbers are always going to be important to us. Trends, patterns, outbreaks, all of those things are going to be important to us. Unless and until we get the ultimate cure for this, and that is a vaccine.
And just with regards to the dark opening, does that mean you're expecting places to be able to open on the Wednesday or the Thursday officially?
I'll confirm those arrangements on Sunday. That is not settled yet. But the notion of that dark opening, giving people an opportunity there's lots of different reasons why you would, if you were running a business, that you'd want to do that. But from our point of view, it is an opportunity, and the public policy logic to it is it's an opportunity for people to go in, make the place COVID safe, so that when they do open, they can fully comply with all the things that are asked of them under that COVID safe planning for them, for their staff, and of course for their customers.
Thousands of people got their hair cut this week, and it seems as if people are still taking records through pen and paper. Shouldn't QR codes or a more digitised form of record keeping be a condition of reopening, given all we've been through?
Oh, I don't think so. I think we can move to that in stages. I think 1-3 Cabs today have made some announcements about things they're doing. Ultimately, pen and paper is fine if it's accurate, and we look at the Kilmore Cafe, that wasn't QR coded, it was pen and paper, and they did an extraordinarily good job to keep absolutely meticulous records. At least that's all the advice I've received. I think as things unfold, you'll see more of this tech used to try and support that. I know that, for instance, there's a number of supermarket chains that you don't have to sort of touch on as you come into the supermarket, but if they ask you to, and if you do, then they've got a record of the fact you were there. So I think these things will take a little bit of time to settle, but I don't see sometimes doing things the old-fashioned ways doesn't in any way inhibit things.
Do you have a message for those planning to protest in the precinct around the shrine today?
Well, the shrine is a sacred place, and not only is it wrong to protest, it's not safe, it's unlawful, and it is frankly shameful that anyone would seek to protest any issue at such a special place, a place that is regarded with such reverence because of what it symbolises. It symbolises, with more than a little irony, the fact that many, many people died to give people the right to protest. The least you can do, if you're determined to protest, don't go there. But I'd argue you should stay at home, because Victoria Police have got enough to get on with. You shouldn't be protesting at all. It just doesn't make any sense.
Are protests still illegal under the Cho
Yeah,
directions?
absolutely they are.
And
You should stay at home. Like, protests don't work against this virus, and they potentially put at risk all the good work that we've done.
have you been briefed on how these potential protesters will be dealt with should they arrive on the Shrine grounds, which I
No.
understand are sacred in themselves and obviously under certain legislation, but you've obviously got the other legislation regarding the Cho directions as well.
I haven't been briefed on the specifics of that. I just think common decency would see people only go to the Shrine when they wanted to remember and to appropriately commemorate the sacrifice of hundreds of thousands of others. That's what the Shrine's about. It's not about making political points one way or the other. Protests are not safe. Protests are selfish. Protests are potentially very dangerous to the strategy we have in place. We want to get the place open, and we want to make announcements on Sunday. And if people are out protesting, that does not help.
But groups of 10 from 2 households are allowed to gather.
Yes,
and people
they
are
are.
socially distant.
Yep.
And surely
But that's
there's-
very different, Lundy. Though, if you're going to have a picnic, that's very different to someone who's got placards and protests. That's a very different thing. That's a very different thing.
Just on the northern suburbs.
And one thing that puts some of those settings at risk is if people are out there gathering to make political points. And now's not the time for that. There will be a time for that, and it's a really important part of our democratic system. Not at the Shrine, I might add, but in a broader sense, people can have their views. But it's an unusual year, and we'd like it to end. And the best way to do that is if we all do the right thing.
Sorry to interrupt before. On the northern suburbs, what improvements have been made in recent months, Premier, on communication with non-English speaking communities? And secondly, is the northern suburbs local contact tracing hub being used for this outbreak? I don't believe it was operational last week.
Well, there are differences between those who might do contact tracing and those who might do public health work, which is broader than that. So it's about community information. It's the first point of your two-part question. Look, I think that every day we look for different ways, enhanced ways to get to some communities that are pretty hard to get to. They're hard to sometimes connect with, and that can be language issues, cultural issues, all sorts of different things. There's not any one particular group that we're focused on. We're focused on everybody, and everyone has their own unique circumstances, and some people have unique challenges as to whether we can get the public health messaging and compliance and a proper understanding of what's required of them
What are some
through.
of the changes to-
So
to
there's
improve
been
communication?
there's too many to mention, but we engage with community leaders. We use multicultural media. We use mainstream media. We use all manner of social media platforms. We do lots of old-fashioned stuff, literally having meetings with people and enlisting them to go and speak to people within the community. So genuine people who are looked up to, whether that be a faith leader or some other leader in a given area, all of that and more. And I think it's fair to say there's a constant search for ways in which we can better link with the diverse communities that make up our city and state. That's an ongoing project, and I don't think we'll ever get to a point where we can say, oh, well, that's all fine. We don't need to keep looking for other ways to do that. It's a constant thing. And I think the good news is that it's actually working. We've got, I think, better linkages with people across the board, right across the city, right across the state, than we've perhaps ever had.
Jerome mentioned there were fragments of the virus found at Ararat.
Yep.
Through those wastewater systems. There's
Yes.
a pop-up testing clinic there. What is being done for inmates at the Hopkins Correctional Centre? Are they being tested?
I need to come back to you in terms of what Corrections Victoria are doing about that. It is well known and well understood to us that within that catchment there are not just one but two correctional facilities. We will get an answer for you on what's exactly happening there. Prisons have been extremely well managed. They've been, even with COVID rules in place, so not as many trials going on, not as many arrests being made, I suppose, in a broader sense. Those who run our prisons, Corrections Victoria, have done an amazing job to keep the virus out. But on the specifics of that, I'm more than happy to come back to you.
Just in terms of the mystery cases, there's 10 at the moment, obviously from that date.
There is.
What are you expecting in the next few days? Will some of those be dropping off, or what are you expecting in terms of mystery cases? Are you confident that the numbers are now trending in the right direction, that not many more seem to be coming up?
If memory serves me correctly, there are 2 that drop off tomorrow and 1 that drops off on Sunday. So barring any additionals, we should be down to 7 by Sunday, that if my memory is correct. Beyond that, there's still some work going on around that expert panel looking at individual cases, and there may be cases that come into that over the course of time. What we know is that there's at least a couple of those 10 are there via a total abundance of caution. They may not be mystery cases at all. We have some sense, but we can't establish to our satisfaction to that really high standard that there is an index case. So again, it's through that abundance of caution. But I think the trend is with us on those numbers also. Less overall cases will mean less mystery cases because they always form a percentage of the overall, and that's been pretty steady. It's at 10 to 15%. So.
Premier.
Last question.
Premier, just sorry, back to the protests, if you wouldn't mind.
Yep.
I'm told from my colleague who covered the news conference yesterday with Lou Cornelius that he didn't categorically condemn the protest or say that it was unlawful. That police yesterday outlined that they'll today be asking people if they've come from further than 25 k's away, and how many households they're in.
Well, you can't be in more than 2 households. You can't be in a group of more than 10. You can't be 25 k's from your house. Like, if you want to completely abuse the fact that we're allowing people to gather for the purposes of a picnic, say, or to see family they've not seen for months, and then turn that into a stunt at the shrine, that is not right. That is simply not right. And if any rules are broken, any rules, Victoria Police won't hesitate to act.
Premier, can you say where Professor Brett Sutton is today?
He'll be doing all sorts of work today, making sure that we're ready to make announcements about restrictions on Sunday. I think he'll probably be here tomorrow.
Was this a planned day off?
I couldn't tell you. Yesterday certainly was. He doesn't work Thursdays. I'm not sure what the plan was today, but I know he'll be working hard. We are all working hard to be ready to be making those announcements on Sunday, and I will predict, I can't be certain, but I'll predict that he'll be here tomorrow.
You and the PM signed off on airport, right?
I know he's very busy. We all know he's very busy, but it is unusual that he hasn't been here for 4 days.
No, I
a
don't
very,
think-
very important week, both for contact tracing and the health response.
every
do you
week
acknowledge
is-
that it doesn't engender public confidence in your confidence in him if he doesn't appear with you consistently?
No, I wouldn't make that acknowledgement at all. He doesn't work every single day, and when he does work, his work includes more than standing here answering your questions. His work involves many, many things. And I'm pretty sure he's going to be here tomorrow, and you can ask him lots of questions then.
Have you and the PM signed off on airport rail?
We are very close to being able to make some very significant announcements on what is one of the biggest projects that our state has ever seen, and that means jobs. It means thousands and thousands of jobs, and giving that larger part of our construction industry the certainty of knowing that there's a pipeline of work, so they can plan and they can spread the cost of their operations off over lots of different projects that they may well win. That's about confidence and making sure that that sector is strong. Today's not the day to make announcements about that, but we will be able to quite soon. And I think you'll see that project will be part of the biggest infrastructure agenda, both large and small projects, biggest jobs agenda, so families have got certainty that the state's ever seen, between partnerships with the Commonwealth and things that we'll do, which will be announced in coming weeks.
Are you just waiting for the PM to be able to get down here to make that announcement?
No.
And
But we'll welcome him when he does, and we'll be able to make that important announcement.
Can you just give us a preview of National Cabinet before you head in? Just what are you hoping, or what can Victoria expect out of today?
Oh, it's a pretty stock standard meeting. We'll cover a whole range of different issues, but there's no massive development that I think I'll be reporting to you afterwards. I think the Prime Minister will probably speak on behalf of all National Cabinet members at a press conference later this afternoon. Perhaps I don't know that that's the case, but that's usually the way these things go.
Premier, just on National Cabinet there, you flagged potentially reopening international flights into Victoria by Christmas. What do you say to Victorians who might be looking to travel interstate for Christmas or vice versa? A family coming to Victoria
Sure.
for Christmas, is that on the table?
Yes, it is, and we're working as hard as we possibly can to have the borders open and to have a freedom of movement between metropolitan Melbourne and regional Victoria, between Victoria and other states. and subject to some quarantine arrangements, people coming from overseas into Melbourne Airport and into a quarantine arrangement that's safe for them and safe for every single Victorian. We want all that up and running by Christmas. That's our aim. I can't give you a definitive date. I can't guarantee that, but that's certainly what we're working towards.
Is it a tough job convincing your National Cabinet colleagues to open up to Victoria?
No, I don't think so. I think we made a commitment that the board we were happy to. Sorry, happy is probably the wrong word. We were understanding of why they had closed the borders, and the best thing we could do is get our numbers down to as low as possible. That would be the most meaningful way to get those borders open, and that's exactly what Victorians have done, and I'm proud of Victorians for that effort. And I dare say that today's National Cabinet will involve a pretty clear acknowledgement from all other First Ministers that the people of this great state have done an amazing job in getting these numbers down in extraordinarily difficult circumstances.
Premier, just on
Last
interstate
question.
travel,
Yep.
do you see any value in border testing? So testing at the border for those states, given that this could be with us for months and months ahead?
To be honest, I haven't really turned my mind to that. I think it is much more likely than not that we will get interstate borders open before the end of the year, provided that everybody's case numbers, not just in Victoria but everywhere, everybody's case numbers are low. We are well on track to be able to achieve that. That's our aim, and hopefully we can have those borders lifted, including the border between metropolitan Melbourne and regional Victoria, so that there is a much greater freedom of movement. I will again say, though, I'm not encouraging anyone to go interstate anytime soon. If you want a holiday, or at some point when that's allowed and when that's appropriate, between now and the end of the year, then there are lots of places in regional Victoria that have done it pretty tough, and they'd be only too happy to have you along and make sure that they look after you to the highest standard.
And just finally, obviously your Queensland counterpart is in the midst of a campaign. Have you spoken to her at all during that time?
Yeah, I speak to Anastasia. She's a good friend and someone who's working very hard for Queensland to keep Queensland safe and to make sure Queensland's strong. And if there's no other issues,
What are you doing for the footy tomorrow night?
I think I'll get to watch the second half, because the first half I'll be in meetings determining what I'm going to be announcing to you on Sunday. No other issues?
Yeah, that's it.
I think it'll be a very close game, and I think Geelong will win by a goal. That is my prediction, but we'll have to wait and see. I think it'll be a genuinely fantastic game of footy. Any other issues? If not, see you tomorrow. Thank you. I've been watching the tips, Jerome.
I'll go to Geelong.